Hey, this is Doug Fields, CEO of the Institute for Healthcare Consumerism, joined by my co-host Brent Macy, Managing Director, and welcome back to this segment of Healthcare Consumerism Radio. We're pleased today to have one member of our legal leaders with the IHC, and a longtime friend of the Institute, John Kaegi, Chief Strategist with Healthstat. John, good morning.
Good morning. How are you guys today?
Doing fine. Are you out in Washington today?
I'm actually in Oregon today.
Oregon Day. Yeah. I knew you were out there somewhere. John, great to have you on the program. Give our audience a brief background on Healthstat, and then we'll get into the connection here with exchanges.
Oh, sure. Healthstat is about a 10-year-old company that is involved in creating on-site healthcare and health promotion. We partner with an exclusive arrangement with ProChange Behavior Systems to provide the best quality possible health behavior change, while we're also providing urgent care type primary care on site for employers.
You know, John, I don't know whether you were able to listen to the previous segments, but in the conversation we had today with the various exchange players, and we have continually in the exchange space, there's always a pause around the health management and health promotion piece. And I think most people will say that at first place there was concern that health management, health promotion would be disconnected and may fall away. But it's quite the opposite, is it not? I mean, you're pretty bullish on where you see the space.
I'm very bullish on it. Actually, it was almost a year ago that I predicted that almost all, if not all, self-insured large employers would go to private exchanges eventually. And one of the reasons is because it offers them the opportunity to bundle in to their plans the kinds of health promotion and incentives that will improve their employees' health, which alternatively improves their productivity, and obviously then reduces downstream healthcare costs. So the private exchanges offer a kind of a one-time administrative cost benefit and a long-term lower cost due to the competition on the exchange by the various insurers, and employers can then reinvest those savings into the kinds of health promotion that will ultimately lower their healthcare costs.
John, when you look at your solutions specifically to private exchanges, what is the thing that the employer really needs to know about your products and where your connection is to that exchange?
Well, right now we're not officially or formally connected to exchanges. Right. We think there's a wonderful opportunity to do so, particularly for our model, because our model is more than just on-site healthcare, which in and of itself is a great value for employers and always provides an ROI. But the real benefit of the Healthstat approach is the health promotion that we provide, as I mentioned, through our partnership with ProChange, which allows our clinicians to use the best-in-class health behavior change techniques that ProChange has pioneered. And so our clinicians have access to information not only about the risks, the health risks of the employees that they're working with, but also about the readiness to change stage that those employees are in. And combining that with the risks allows us to customize the health behavior changes that are necessary for each employee. Now, the great opportunity here is, and we're very excited about this, is that as employers move to a defined contribution approach on the healthcare exchanges, away from single carriers, but more toward choice for their employees, that they're going to have the additional resources available now to invest in an on-site health promotion solution like ours, or any other kind of wellness program that will not only help them lower their downstream risk of cost increases, but also improve the productivity of their employees, and also improve the morale of their employees, because all the changes that are occurring in healthcare are somewhat intimidating to people, and having a stronger, very highly desirable on-site healthcare solution helps to compensate for that anxiety that they feel.
Yeah, that makes a lot of sense, John. And also, as we've got more integrated engagement and communications and education, you're right at the center of that with what you're doing with your solution. So you marry well with what the exchanges are going to be doing to try to make sure they keep that consumer population engaged with them.
But I think what Doug, what he's talking about with the with his connection, the health promotion piece to the exchanges, definitely a very good connection there with the private exchanges. What decisions will employers have to make about health benefit options available on those private exchanges, and what can they do with those decisions, and what are the best decisions that they're able to make?
Yeah, I agree, and I think the health and productivity side. All three of our guests have talked about that. Even though that's John's sweet spot, all three have talked about the importance of that, the health management and health productivity piece.
Yeah, and I think when we had mentioned before on the program that we actually had the pleasure to go listen to some of these exchanges in a conference, and what they really talked about is health and wellness and promotion is a very big piece of all these platforms. Picking up on your last point, I think one of the things that Doug and I were talking about are the decisions that the employers are going to have to make about the health benefit options available on these exchanges. What kind of elaborate on that? What are the decisions that employer is going to have to make within this platform?
Yeah, the employers, the good news is the employers, once they make those decisions, will be able to reduce the amount of administrative oversight that they have of their health plan and turn it over to the private exchanges, which is going to reduce the number of human resources employees that they need, and that gives them some of their savings. The decisions they have to make, though, is what kinds of plans they're going to put their employees into, and this is a very important question. I'm writing a blog about it now. And that is, do they want to go to a defined contribution approach so that they can make their costs more predictable and also share more of the cost increases of the future with their employees to generate more consumerism? That all sounds great, and it sounds like a no-brainer, except when you're in the employer's shoes, you might think that may create a competitive benefit disadvantage on the labor market against your competitors who may not do that. So a competitor may say, I'm going to keep my defined benefit program, and that may be appealing to the employees. So what does the employer do about that? They want the benefits of the defined contribution. They want their employees to share more of the cost, so that they have skin in the game and they're better consumers. But they don't want to create a benefit disadvantage. Right. And what they need to do about that is to take that extra money that they've saved and invest it into creating a culture of health and well-being on their campuses for their employees that will raise that morale and make them once again the employer of choice on the labor market.
I think to your point that's well stated, John. Specifically since we legitimately have a skilled worker shortage in this country, so I think it strategically is. Employers have to take a careful approach to which way they move in that competitive environment. But to that point, too, would you not agree that if all at once the competitors start to move that way, there's going to be this giant sucking sound of, them moving to this private exchange defined contribution model?
Yeah, I believe in tipping points, and I think we're at a tipping point already with the private exchange, just a year into it, really. And that's why I really do predict that 90 to 100% of large employers that are self-insured are going to be buying their health insurance from private exchanges in the next 5 years. So some of the surveys show anywhere from 36% to 70%. But surveys are based on what people think and say today. And if you follow the money and you think about the advantages and the value that the private exchange provides versus an individual carrier, then it doesn't take too much wisdom to figure out that almost everybody's going to be moving toward that higher value private exchange solution.
Yeah, and that, for our audience to hear this too, because we've heard from the exchange players themselves, and now we're hearing from you that is one of the leaders in the health promotion and on-site health management space, is that health management, health promotion is alive and well inside the exchange environment. It's an important programs for employers to put in place for productivity, for risk management, for skill retention. Agree?
That's right.
Yeah.
The private exchanges want to have health management going on inside the exchanges. And you think about if you have multiple carriers in your exchange, it makes it more difficult for the carriers to use their wellness tools. So the private exchanges are looking for other ways to accomplish this, and we think that Healthstat provides that solution.
Hey, John, we've got about a minute or so to go, and I really appreciate you having us on. Are you spending this time with us today? Sorry about that little breakup, but I want our audience to know that you'll be able to hear John in person if you can make the Las Vegas IHC Forum West. He'll be conducting a workshop there and participating in the event. But John, leave our audience take a minute or so and leave our audience with some takeaways, please.
Well, sure. So private exchanges can reduce the administrative costs of employer health benefits. That provides an opportunity for the employer to reinvest those savings into health promotion. And of course, health promotion reduces downstream health care costs and improves productivity, which, by the way, is more valuable than even reducing health costs. So it's a win-win for the employers. And it's a win-win for the employees because now they have more choice to use the defined contribution they're receiving from their employer toward the purchase of the right plan for them, not having their employer make that decision for them. And so as the private exchanges demand better results from health promotion programs, companies like Healthstat have firmly taken a lead in patient engagement and health behavior change as a way to partner with them to be able to accomplish this for those employers. We're excited about this prospect, and I think most employers already believe that health promotion can provide them with relief from their insurance costs, but many struggle to find economical ways to implement them, and we think the private exchange is that solution.
Well, John, we really appreciate having you on the program today. Have a great weekend up there in the Northwest, and look forward to seeing you at IHC Forum West. To the audience, again, the promo to access the private exchange database at privatehealthcareexchanges.com is IHC Radio, all caps, and you can get discounts on the subscription models there. John, again, thanks so much, and to the rest of our audience, we will talk to you next Friday on Healthcare Consumerism Radio.
Thank you, Brent and Doug, for having me.